All right, let's get right into it. If you're in medical training right now, I want you to listen up. Palliative care, it's not some niche thing you'll maybe refer a patient to down the road. Nope, it is a core, absolutely non-negotiable part of your skill set. And today, we're going to break down exactly what that looks like in your day-to-day. So I want to start with a number, a big one, 18,000. What is that? Well, that's the estimated shortage of palliative care specialists just in the US. And that's just to cover the hospitals. This isn't some problem for the future, This is the reality you are walking into on day one.
So here's what we've got on tap. First, we'll dig into that massive gap. Then we'll talk about palliative care as a skill, something you do, not just a referral you make. We'll get into why this is your job, what your 4 core skills are, and then we'll wrap up by looking at how team care is evolving to have your back.
All right, first things first, let's really get a sense of just how big this problem is. We're not talking about a few empty slots here and there. This is a huge systemic gap that's hitting patient care hard. And honestly, your generation of clinicians, you're the ones who are in the perfect spot to start closing it.
So why does this gap even exist? Well, it's complicated. It's not just one thing. Beyond the straight-up workforce shortage, check out these geographic differences. A hospital in New England is almost twice as likely to have a palliative care program as one in the central Southwest. That's wild. And then you pile on the fact that most specialists are stuck in hospitals, referrals are coming in way, way too late, and our population is getting older. Yeah, it's pretty much a perfect storm.
And this chart, wow, this really puts it all into perspective, doesn't it? For every single board-certified palliative medicine doc in the US, there are about 40 board-certified internists. Let that sink in. 40 to 1. The takeaway here is so clear. We will never, and I mean never, be able to train our way out of this shortage with specialists alone. It's just not possible. The only path forward is for all of you, the primary clinicians, to step up and own this. Okay, so if we can't just keep referring patients out, then what do we do? The answer really starts with a change in how we think about this. It's a huge mindset shift. We have to stop seeing palliative care as just a place you send someone and start seeing it as a skill that's part of your practice. So let's just level set for a second. What are we even talking about when we say palliative care? At its core, it's about one thing: improving quality of life. That's the goal. And let's be clear, this is not just for the end of life, not at all. It can happen right alongside curative treatments like chemo. It's for any age, any stage of a serious illness. This simple idea is the foundation for everything else we're going to talk about. Okay, this slide is probably the most important one we'll look at. You've got 2 models here. On the left, you see primary palliative care. Think of this as your lane. This is on you. We're talking about managing basic symptoms, having those first and super important conversations about goals of care. That's your job. Now, on the right, that's subspecialty palliative care. That's when you call in the cavalry. For the really tough stuff, pain that won't quit, intense family drama, knowing where your lane ends and theirs begins is what lets you act with confidence and know exactly when to ask for help. But look, taking this on, it's not just about filling a gap in the workforce, right? This goes deeper. Embracing primary palliative care is about what it actually means to be a doctor. It's a professional mandate. Just read this quote. It really says it all, doesn't it? This idea isn't new. This goes all the way back to the Hippocratic Oath. Relieving pain, showing empathy, helping patients make choices that line up with their values, that is the job description. Primary palliative care is just the modern name we give to that ancient promise. And the cool thing is, when you lean into this work, the payoff is huge, and it's immediate. Your relationships with your patients get so much stronger. You cut through all that fragmented care that just confuses everyone. Your patients feel like you're actually with them, not like they've been passed off. And hey, on a system level, this is a total win. It hits all the marks of the triple aim of healthcare reform: better patient experience, better population health, and lower costs. It's a win-win-win. All right, so we've talked a lot about the why. Now let's get into the how. Let's get super practical. What are the actual skills you need to have in your toolkit? Let's break it down. I want you to think about this in 4 big buckets, 4 domains. Number 1, you got to be a rock star at managing physical symptoms. Think pain, nausea, shortness of breath. Number 2, you have to look beyond the physical. What are the psychosocial and spiritual needs of this person? You have to address the whole human being. Number 3, communication. This one's huge. You have to get good at having those really tough conversations. And finally, number 4, you're the quarterback. You're coordinating their care, especially when things get bumpy and they're moving between settings. These 4 pillars, this is the bedrock of primary palliative care. Okay, I know what you might be thinking. That sounds like a lot. And you're right, it is. But here's the really good news. You are not being thrown into this alone. The future of medicine is all about teamwork, and there are some really cool new models popping up specifically designed to support you.
So one of these new tools is the e-consults. This is a game changer. It basically lets you shoot a quick question over to a palliative care specialist and get some advice without having to do a full formal referral. It's a super fast, low-hassle way to get an expert brain on your case. Then there's something called Project Echo. This thing is brilliant. It uses video conferencing to connect specialists with primary care docs, especially those out in rural or underserved areas. Think of it like a virtual version of Grand Rounds. It's all about sharing knowledge and building a community, so it doesn't matter where you practice. It's a way to get expertise to everyone, everywhere. And of course, there's just plain old telehealth. The rise of video visits has been huge, right? It lets us connect with patients who are too frail to come into the clinic or who live really far away. It just helps us make sure that where you live doesn't decide the quality of care you get. So when you boil it all down, what have we learned? Palliative care is active. It's about living better. It's not a last resort. And because of that specialist shortage, it absolutely has to be part of your practice. There's no way around it. So the real question I want to leave you with, the one you should take back to the clinic with you, is this. How are you going to start weaving these skills into your everyday patient care, starting now?